Deneen, you can go right ahead.
Thank you. So my name is Deneen Diamond, and I'm the lead for the Center of Excellence for Health, and I'm thrilled today and honored to introduce our guest speaker. Rachel Colpitts is very excited to bring her awareness of the world of medical laboratory science to youth. For various reasons, university didn't work out for Rachel. She was introduced to med lab studies at 28 years old. Now, she is a medical laboratory technologist that completed her training at the top of her class at MBCC. She worked in a hospital lab in PEI and then moved to be an instructor in the med lab at MCC. She has always loved science with a passion of biology. She loves the med lab profession because it combines science, technology, and helping people all in one. New Brunswick Community College is a learner-focused community that emphasizes getting students the skills they need to do the job they are studying for. It offers a number of programs for great careers, including MLT, MLA, and other healthcare professions, and has campuses in Moncton, St. John, Fredericton, Miramichi, St. Andrews, and Woodstock, all with different program offerings. Opportunities for academic upgrades, single classes, credential courses, students can check it out by going to mbc.ca. The Center of Excellence is partnered with MBCC, and I am very happy and honored to present Rachel Colpitts. And just as a housekeeping item, if everyone can turn their mic off except for Rachel, that would be wonderful.
All right. Hello, everybody. I'm Rachel. I'm very excited to be here today. I love this profession. I love that I have the chance to share so much of it with you today. So first thing that I'm going to start out with is a quick poll. So I was wondering how many of you have heard of medical professions other than nurse or doctor? So this is kind of like Kahoots, if any of you have used any of that stuff. You just go to this little web page here. It says it right up at the top. Respond at pollev.com/Rachel Colpitts 763. And you can put in your answer, yes or no, if you've heard of any other medical professions. Just make it a little interactive.
Rachel, is there any way that you can minimize the feedback on your microphone?
Let me see. I'm not sure because it might be because I'm up in the lab, which is loud.
If you click the dots at the top.
Yep, device settings.
And then go to device settings.
Yep.
It says noise suppression. If you click hide, it should take that away.
Hopefully, let's hope that works.
There, that's perfect.
Good.
Okay, perfect. Hopefully that will help with here.
So we still have a few people responding. Oh, the sun's coming in now. Good, lots of you have. That's wonderful. A lot of people haven't heard of professions other than nurse or doctor. They think nurses do everything and doctors do the rest, and that's it. So it's wonderful to see that so many of you have heard of other healthcare professions. That's fantastic. I'm going to talk about medical lab professionals here today. So where do doctors get their answers? And I just asked you this one right here. Do any of you know of any medical professions other than nurse or doctor? And most of you, and everybody that answered did, which is fantastic. I'm so pleased to see that. But here's a list of a lot of the other medical professions. There's respiratory therapists that deal with the lungs. So if you know anybody that has asthma or something, it might be a respiratory therapist that they see. Personal support workers, physiotherapists, pathologist assistants, nuclear medicine technologists, they're the ones that handle x-rays, pharmacists and pharmacy assistants, registered nurses, licensed practical nurses, and nurse practitioners. So even with nurses, there is different types of nurses. Massage therapists, chiropractors, even those are considered healthcare professions now. And phlebotomists or venipuncture technicians. This means somebody that takes your blood. So what I'm here to talk to you about today is medical lab professionals. So medical lab professionals include medical laboratory technologists and medical laboratory assistants. Medical lab technologists, that is my role, and we're the ones that actually analyze the specimens to get the results. Medical lab assistants aid us in doing that. They help us prep specimens. They can help take care of some of the instruments. In some places, MLAs do a lot of phlebotomy or blood drawing. So in Canada, 1.2 million lab tests are performed every single day. And 70 to 75% of all medical decisions made by doctors in Canada are based on the lab results that we provide. And there are different areas of expertise. So if we just take a second, I'll show you a couple of goodies that I have here. For phlebotomy, for blood drawing, we have all these different kinds of tubes. Not sure if you'll be able to see them very well. And you'll notice they have different colored tops. So we have this pinky purple one, and we have a yellow one, and we have a green one. There's blue ones, there's red ones. That color top tells us what's in that tube. So for example, this purple tube has something called EDTA in it. That chemical that's in there keeps the blood from clotting, keeps it from becoming that jelly gross, and keeps it liquid. We use this when we need to look at blood cells under a microscope. This one here, it has an additive to help clot, and it has this little gel thing at the end, if you can see the gel tip there. And what that gel does is when we spin blood, it separates it into a solid portion and a liquid portion. And this gel will be in between the two. And that lets us get at just the liquid portion if that's what we need. This is another tube that has a different kind of chemical in it that prevents it from coagulating. So each one of these tubes is used for a different purpose. And that's one of the things that we have to know. We also have this little wee one. This one is when we have a patient like a baby or somebody that has veins that are very, very hard for us to get at. And what we do is we poke their finger or their heel instead, and we fill up this little tiny tube. So if you were ever wondering how do they get blood on babies, we poke their foot and we fill up this little tiny tube. So MLTs, med lab technologists, are trained to do that. MLAs are as well. MLTs can do it. MLAs do it in more places. And in a lot of places, it's nursing that takes care of that, but it's one of our skills. So let's have a look at some of the different areas of expertise. So in Canada, I took this from the CSMLS webpage. That is our certifying body. So as professionals in healthcare, we have a body that makes sure we are capable and competent to do the work we do. So here we have 500 cases of cancer diagnosed every day in Canada. That's lab techs. They prep the tissue for a pathologist to look at and to determine whether cancer is present. 70,000 heart attacks occur in Canada each year. How do we know it's heart attacks? Well, there are test methods like an ECG, electrocardiogram, where they stick all the electrodes all over you, and that can give them an idea. But how they monitor it is lab tests. We do lab tests in this little green tube. and it tells us, is a patient having a heart attack or not? How long ago did they have that heart attack? When did it start? We can actually tell that. 2,000 units of donated blood are needed every day. So if you've ever heard of a blood transfusion, where somebody, say, is in a bad car accident and they lose a lot of blood and they need to replace that blood, we have units of blood that we can give to them. And we do 2,000 units of donated blood are needed every day in Canada. And 14,000 traumas occur. So that can relate back to needing blood transfusions. We have tests that we can do on blood that tell us if there's tissue damage, that tell us how a patient's doing, that tell us if we need to replenish anything. There's all kinds of things we can tell from these test samples. So our first section that we have, our first discipline, is hematology. Now, hema refers to blood. So if you hear the word hema in front of anything or the prefix, they're talking about blood. And ology is the study of, the science or the study of something. So hematology is the study of blood. Sometimes you'll hear like a really big bruise where a lot of blood bled under the skin and it creates this big bump called a hematoma. It's because they're referring to the blood under the skin. So if you look at this slide here, this is what your blood actually looks like under a microscope. So here we have the red cells, which you may have heard of. The red cells contain something called hemoglobin, which transports oxygen in our bodies so that when we breathe, we can use that oxygen. That's what moves it around our bodies from our lungs to our tissues. These little tiny specks are platelets. They help you clot. So when you cut yourself and you start to bleed a little bit, but then it stops on its own and you start to get a scab, platelets have to do with that. And over here are the white blood cells. And I know you're looking at them and probably thinking they're not very white. They were actually named in the 1800s when they first looked at a blood smear without a stain, without any color added. This is stained with a special stain that gives it that pinky color and that bluey color so that we can look at it more easily. So those white cells or leukocytes are one of the things that help you with immunity. They're what help keep you from getting sick. So this is an example of what a lab report looks like. We have a CBC report, which is a complete blood count, which means we're looking at all of those different cells. And this is actually mine, so I'm giving myself permission to show it to you. Confidentiality in healthcare is a big deal, so I couldn't show you another patient's without their permission. That's a big no-no. So I just grabbed one of mine that I had, and I'm showing you that one. So here you can see white blood cell. So those are those weird little ones with the squiggly blue middles. My result was 12.13, and that was high. Normal is about to 10.4. So it was a little bit high. Not a big deal, nothing too serious. But that's what happens when something is high, it will mark it like this. It will show you. It'll flag it, is what we say. So the reason my white blood cell count was a little high is when I went and had my blood done, I was just getting over a little bit of a cold. So because your white blood cells actually look after your immunity, when you have a cold or something, they will usually increase. Your body will produce more to try and help you with your immunity. So this is our normal blood smear again. This is what we expect to see a blood smear look like when we do one on a patient that is not sick, or if they are sick, it's not affecting their blood cells. And we call it a smear because we take a slide and we smear it on a slide to see it. So this is what a normal one looks like. Our red cells are mostly round. They have a little bit of this blank spot in the middle, kind of like a donut. And we have these white cells that are about 3 times the size, and they have these weird little, that's actually a nuclei. So they have these weird little squiggly bits that are darker in there. Have a look at this one. Does that one look different? It looks very different, and it's can be hard for you to see when you're not trained in it. But if you look at this one compared to this one, apart from the color, because they're different images, but you can see how these look less like donuts and more like SpaghettiOs now. That central part, that piece in the middle, that hole is much, much, much bigger. So what this is we have a patient that has iron deficiency anemia. That means that their body isn't getting enough iron to make enough hemoglobin to make the red cells the right size. So if they don't have that chemical, that protein called hemoglobin, they can't transport enough oxygen to their body, so they might be out of breath. You may know somebody that has anemia, that gets it regularly, or had anemia before because of an accident, or they didn't have enough iron in their diets. There's a lot of things that can cause anemia. This one specifically is iron deficiency. And yeah, we can tell that it's iron deficiency anemia by looking at this picture. So if somebody shows up at their doctor and they say, oh, I'm really, really tired, I can't seem to catch my breath, I go up the stairs and I'm breathing really heavily and my face is always really pale, and the doctor orders a CBC, a complete blood count, we'll do one of these smears, and if we see this, we can report to the doctor. The reason that they are having a hard time catching their breath is because they are anemic. They don't have enough hemoglobin. They can bring the oxygen in, but they can't transport it anywhere. So that's one of the things that we can tell a doctor, and they can say, oh, okay, well, now the patient needs to take these iron supplements, come back in a couple of months and we'll test it again and see if it looks better. This is a picture of a leukemia. Many of you have probably heard of leukemia out and about in the world. Leuco actually refers to white. Leuco means white, and that's why they're leukocytes. And emia means something in the blood. So there's a lot of something in the blood. So that's why we call it leukemia. It's the white blood cells that are reproducing out of control. We have too many of them. So if you remember what they looked like in the other slide, if we go back here and see these ones with their chunky little nuclei, these guys look very, very different. They have these really big nuclei that are taking up a lot of space, and they're not as dark. Their color isn't as dark. These are actually what we call blast cells, and that's basically a baby cell. So blast cells usually aren't in your blood when we draw it from your arm. They're usually found in your bone marrow. But when a patient has leukemia, they have what we call disordered synthesis. So it means that their bone marrow isn't making them the right way, and they're getting released out into the blood like this. So when we have a patient with leukemia, this is often what we see. And sometimes this is the first indication. You have 10-year-olds that comes in to emergency because they're weak and they're bruising very easily, and you do a blood draw and you see these, it might be the first indication that that patient has leukemia. So it's a big deal what we do. Sometimes we're the first people to know somebody is sick. This is bone marrow. This is normal bone marrow. So you can see some red cells up in here, and you can see a lot more of those cells that have those big nuclei that aren't as dark and condensed. So we expect to see those in bone marrow. Now with somebody with leukemia, we'll see a lot more. But this is what a normal bone marrow would look like. It has a different composition than what gets released into the blood, because the bone marrow is where things are made. It's the factory. So next we'll talk about histology and histotechnology. So this is the study of tissues. So histology is specifically the study of tissues. Histotechnology is the study of how we prepare tissues for examination. So this tissue right here actually is a cross-section of the small intestine. So your stomach, when you eat, you have your esophagus that leads down into your stomach, and then your stomach attaches to the first part of the small intestine, which is where most of your digestion happens outside of your stomach. And it has these little projections on it that we call villi, and they're called finger-like. And they provide more surface area. They make the intestine bigger, basically, so that you can absorb more food and more nutrients. So this is actually what a section of your small intestine would look like. Now, again, this is stained, meaning we've added color to it, but the stain that we use is one that has been used for so long that it helps us with our morphology. Now, why is looking at tissue important? This is usually how we determine if a patient has cancer that isn't a blood cancer. So this is actually the liver, and you can see how all of these cells, there's a lot of different looking ones, but they look relatively similar. All in this area, we kind of have a palette of cells that look like other cells there. But over here we have this dense patch where they're very different. That's what a pathologist is a doctor that diagnoses disease, especially in tissues. That's what the pathologist is going to be looking for. So if we had a patient that we had to remove part of their liver because of suspected liver cancer, or we did a liver biopsy, we would prepare their tissue, put it on a slide, and the doctor would look at this, the pathologist, and see these cells and say, yeah, it's liver cancer. Also, when they look at those cells, it helps them determine when we did surgery to remove that cancer, did we get all of it or did we leave some cells behind? Because you can actually see it. So just as a warning for anybody that may be a little bit squeamish, to turn away for a second, because the next slide actually shows a fixed kidney. So this is what a normal kidney looks like. It's a cross section of it, and this is a normal healthy kidney. Looks a little bit weird color-wise because it's been what we call fixed. That means we put it in a chemical called formalin that keeps the tissue from degrading. So it keeps bacteria and funguses from eating it. It keeps the cells from liquefying. It basically keeps it in a lifelike state as much as we possibly can. So that's why the colors look a little bit weird. But this is what a kidney looks like when you take it out of a person, and this is a healthy kidney. So for histo, we have a whole lot of different things. So for example, get my camera back up again. We have this little jar here is formalin. And these little jars will be present when you do a biopsy or something like that, whenever you get tissue. And right in there, we actually have some liver tissue. And that's preserved. And that will keep just this side of forever. Now, what we do with that is we cut off, and we take those little bits, and we embed them in these little cassettes. See, it's embedded in there with wax, and you can see how there's a little shape in there. That's actually tissue in that wax. And the reason we put them in wax is so that it's strong enough that we can cut it very, 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 very thin. 2 to 4 micrometers. So very tiny. 1,000 times smaller than a millimeter. So very small. And this is what it looks like when we put it on a slide, if you can kind of see it. So we go through a whole process of making sure the tissue is preserved, it's fixed. Then we can put it in that wax, and then we can cut it real thin. We can put it on slides and add that color, and then the pathologist has something to look at. So our next discipline is blood banking or transfusion science. So this is where we talk about things like transfusing blood. Blood isn't the only thing we transfuse, but it's the one that most people are familiar with. So this is just a quick look at the very basics of transfusion science. Transfusion science actually there's a whole lot of different blood types. These are the 4 main ones. And they're the ones that you tend to learn about in school, like when you're in high school and you take a biology class that talks about blood groups. These are the ones you'll learn about. But in blood banking, there's actually a whole bunch more that we have to pay attention to. So what this is showing us is we have group A. So there's blood type A, blood type B, blood type AB, and blood type O. So if you look at this A red cell has these weird little projections on it, and B has a different one. AB has both, and O has none of them. So those are little things, are markers. They're what we call antigens, and they're just little cell markers that tell you what it is, basically so your body can identify it. So A-type people have these markers, B have these little green triangles or green squares, and AB have the other ones. O doesn't have any. So when we have this blood type in our bodies will naturally develop an antibody, which is a protein that fights off a foreign thing in your body to the blood groups we are not. So if you are blood group A, then you're going to have anti-B in your blood. you're going to have an antibody that will attack B if it winds up in your body. If you're B, you're going to have an antibody that will attack A if it winds up in your body. If you're group AB, you have both of those antigens, you have both of those markers. So you're not going to develop an antibody against either one because that would be unsafe. If you're group O, you have neither one, so you're going to develop an antibody against both of them. So this is really important because antibodies defend us against foreign things that wind up in our bodies. So if you have somebody that has group O blood, their blood type is O, this is the kind of antigens that they have, which aren't any, and you give them B type blood, they're going to have these antibodies attack that blood. And it might be easy to think, well, if they attack that blood, where's the harm? But it actually causes a lot of other reactions in the body when that blood gets attacked. It causes immune reactions like fever. It can cause allergic reactions like itching and rashes. Those blood cells being destroyed can actually cause a lot of toxins to be released in the body. So it can actually make a patient very, very, very sick and can lead to death. So it's really important that when we take care of a patient in transfusion science, that we're giving them the right kind of blood. So here I have a little gel card, which is one of the ways that we look at a patient's ABO blood group, is what we call it, ABO. So we have A, B, and D. D refers to, if you've ever heard somebody say their blood type is positive or negative, that's what the D refers to. If they're D positive, then they have a positive blood type. And over here we tested, so basically we had the patient's blood and we tested it against an antibody to see if it would react. And over here we had the patient's, the liquid portion of their blood, which has their antibodies in it, and tested it against cells that we knew what they were to see if they had the antibodies to help determine their blood group. So this looks like an O negative. And it gets into a lot of different things about why that would be an O negative, but that's one of the ways that we can test for that. So another way is just directly in a test tube. And here is a blood unit. So you'll see on the blood unit, it's labeled O positive. Rh positive is that D. So this blood unit would be good to go to a patient that is O positive. Because O doesn't have any antigens on it as well, we could also transfuse this blood into a patient that is A positive or B positive. So there's a lot of things that go into knowing what is good, what is bad, what can we do, what can't we do. And that's just with the 4 basic blood groups and whether they're Rh positive or negative. Now, the liquid portion of blood I keep talking about, that's plasma or serum, and we transfuse that as well. So when they take a blood donation, they will separate it into different pieces. They'll separate it into red blood cells, platelets, plasma. So that's why they say that one donation can save more than one person. The red cells could save somebody who's anemic or bleeding out because of a car accident. The platelets can help somebody who has leukemia and has low platelet counts and can't clot. The plasma helps us replenish losses due to trauma or anything like that. So we can actually do lots. So this is that liquid portion. This is where all of those proteins and antibodies live. Next, we have microbiology, which you may have heard a lot about in the recent years. So this is the study of disease-causing organisms. If you look over here, you can see kind of what some of them look like on a slide. We have gram-negative, which are those pinky ones, and gram-positive, which are purple ones. There's a bunch of different shapes. There's bacilli, which is like little tube shapes, or my instructor always called them, they look like little hot dogs. Gram-positive, and there's cocci, C-O-C-C-I, which are little round ones. And what they look like, how they stain, how they behave, all help us identify what they are. So this is E. coli on EMB agar. EMB, it's a particular dye that is in the agar. And you can see just a little bit that it has like almost this green metallic sheen to it. And E. coli, again, you may have heard of it. It's a bug that often contaminates vegetables for a lot of reasons. And it has to do with water supply and where your cows live and things like that. But it can cause very, very, very serious disease. So we have to be really careful of it. So if we have a patient that has symptoms that we suspect it may be E. coli infection, we may have to do a plate like this. So I actually have a whole load of micro things to show you because they're very, very cool. All right, so micro, this is a blood agar plate. We call it a blood agar plate because agar is a derivative from some kinds of seaweed that gives it a jelly kind of thing, and the blood is actually sheep's blood. And pathogenic organisms that cause disease, grow better on blood agar plates. So this right here, if you can see all of those colonies on there, how they're kind of greenish. So how those appear on this plate give us clues as to what it is. Now I'm out of practice with my micro, but I did ask my colleague which one that was, and that is Streptococcus pneumoniae. So it is a bacteria that causes pneumonia. This is a different kind of plate. It's called a mannitol salt agar. So it has a like mannitol sugar salt in there. And what it does is if the organism uses it, there's a change of color. So if you look at this one, you can see the different, where all the streaks are, you can see that the color is different from down here where there aren't as many streaks, pink and yellow. That gives us a clue. That is a Staphylococcus aureus. Another type of plate. And you can see how on one side it's cleared and the other side it's not. That gives us more clues. Micro is really cool, so there's all kinds of cool stuff here. This one is a salmonella, which can cause serious infection as well. All kinds of different test tubes. So we have this one, which is urease. If the organism has an enzyme called urease, it will change the color of the agar pink. It doesn't start pink. So this is a positive. Phenol red broth, it's not red, so that tells us something about it. Some more different colored broths. So basically these were all broths that had nutrients in them, and they took a little inoculator, something that had the bacteria on it, and put it in there and swirled it around and then waited to see if it used up any of the nutrients and if that changed the color of the chemical in there. And what things it changes and what things it doesn't gives us clues as to what the organism is. This one's really cool because you can actually see they used a needle to stab the organism down into the gel. And you can actually see where the bacteria is growing all along the line in the gel because it was on the needle. So that's really neat. And ways we get those specimens, you can use swabs. So if you've ever had strep throat or anything and had to get your throat swabbed, people are more familiar with these kinds of things now because of the COVID testing. So if you had to have the nasopharyngeal swab, it's a little bit different because it's a virus, but similar concept. We have these blood culture bottles. So if you've ever heard of somebody going septic, that means they have a bacterial infection in their blood. And we use these tubes, we'll collect the blood from the arm, just like we would other blood tests. And we use these bottles to collect the blood and see if bacteria grows. And then from all of that, we can do this. So here we have a bacteria that's spread on a plate. These little discs that are in the middle, they are antibiotics. So what we're doing is we're using those antibiotic discs to see, do they kill that bacteria? And that's how we determine what antibiotic you should take for what kind of infection. If we have a zone where there's no growth, that means that antibiotic kills that bacteria, which means it should be effective on a person. If there is still growth, then that particular antibiotic has no impact on that bacteria, so it wouldn't be a useful treatment. And micro gets all kinds of samples. It gets wound swabs, it gets throat swabs, it gets lower respiratory tract swabs, which is sputum, and they're the worst. Urine samples, stool samples, everything. Back on the PowerPoint here, we have something called polymerase chain reaction. This is actually the testing that they use to determine the presence of viruses. So they take a little sample of the virus, and then we get some of the genetic material from it. And basically, we use an enzyme, we use a little protein that does work on it, that copies it for us. And it copies it over and over and over and over and over. Because one tiny little strand of genetic material is very, very hard for us to see and read. But if we get a lot of strands, then it'll be easier for us to look at it and say, yes, that virus is present. So when you hear about them doing PCR tests for COVID, this is the kind of thing that they're doing. They're taking the genetic material and just replicating it over and over and over and over in the hopes that they will find whatever is there making a person sick. This is an example of a microbiology report. Again, it's mine. So this was when I started school. We had to get vaccinations for hepatitis B. And that was because we'd be working with high-risk specimens. And so I had to get vaccines. And to prove my immunity, I had to go to my doctor and say, hey, I need to get what we call a titer done, T-I-T-R-E. And it is basically a test that determines how many antibodies are in your body. So for my Hep B, we have Hep B antibodies, we have reactive, meaning they found that it was, I had at least 100 of these antibodies per milliliter in my blood, which indicated I was probably immune to Hep B. And that meant I didn't have to get another vaccination. Not at that time, anyway. So a lot of tests fall under the heading of chemistry. Chemistry is a huge part of the lab. Chemistry is also a little bit of a misnomer because we use a lot of chemical tests when we're doing chemistry, but a lot of what you learn, a lot of what it's reflecting on how the body works is actually biology, but it's chemistry because we use biochemical tests. So this is an example of a chemistry report. So you can see there glucose. If you have any friends or family that are diabetic and they talk about their blood sugars, they're talking about glucose. And there's a range for where glucose is safe to be. So you may have also seen one of these little guys. It's a little glucometer. These right here, a little glucometer. And these are household items which changed the world of treating diabetes. But we still have them in the hospitals too, because nurses want to be able to check a patient's glucose right in the moment. However, if they get any weird results or anything like that, they can send it up to us in the lab because our results are a little bit more precise. So that means if they suspect that their instrument's not working, or if they get a really high or low, then we can double check it for them. So that glucose, there's a check mark beside it because it's fine. It's in the normal range, it's okay. Creatinine is something we look at to check kidney function, same with eGFR. Electrolytes, that's what lights are, sodium, potassium, chloride. When you hear people talk about electrolyte drinks, that's what it means. It means that it has like these lights in it, sodium, potassium, chloride, and they're essential to your body's good health. So you can see here we have my sodium result, 139, and what we expect it to be is between 136 and 145. So it's normal, it's fine. The one on the bottom down here that says high, uric acid, that is a byproduct of some of your metabolism, and it creates a condition called gout. If you have high uric acid, it creates a condition called gout. I don't have gout, I just have high uric acid, which is a genetic condition. But gout is a horribly painful thing where that uric acid gets deposited all in your joints and does damage to your joints, and it's very, very painful. So part of chemistry is urinalysis, urine specimens. That's a fake name on there. So just so you know, that's one we made up for lab use in the school. Urinalysis can be, they can do it in micro where they're checking for UTIs. So they're looking for bacteria and UTIs. Or it can be in chemistry, and we use this little test strip here. We use this test strip. And you can see all these different colored pads on it. They're each for a different thing. And if that thing is present, it will change the color of that test pad and tell us if there's something in the patient's urine that shouldn't be there, like blood or protein. So that helps us determine if the patient needs further investigation or anything like that. Stool samples. Stool samples you will see in micro and in chemistry. Oh, wait, sorry, that's the wrong kind of stool sample. Here we go. So stool samples you will see in micro, that's where they would have gotten the original specimen to do the Salmonella plate or to do the E. coli plate, would have been a stool sample. And we also do something called a fecal occult blood test. And there's a couple of different kinds of this, but this is neat, assuming stool doesn't bother you. There's this little test thing here. And you can see the little windows. So what happens is they take a little sample of the poop and they smear it in that little window. And then on the other side, we apply what we call a developer. If there's any blood in that poop sample, the developer will turn blue. And that tells us that the patient has blood in their stool or something that's reacting with the developer. The reason why that's important is it's a major screening process for finding colon cancer. So if you look at this, you'll see these two little circles. I'm going to apply my developer to those two little circles. And you can see that one of them is turning blue. That's basically just a check to make sure that our card has all the appropriate chemicals and everything in it. So if you did that with a patient specimen and it had blue developing in it, that blue would indicate that that patient may have blood in their stool. And that's something that needs to be followed up on. So if they have colon cancer, we can find it quickly and treat them. Colon cancer is one of those things where if you catch it early, your chances are much, 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 much better. So it's a very valuable tool to us. There are other kinds of testing that we do with stool samples. One of them is a fecal fat, which is to determine if you have fat in your stool, like you're not digesting things properly. They don't do it as often now. One of my former instructors had a really great story of they would put it in a can and shake it, and that would create pressure. And then she took it in the elevator. And the pressure change in the elevator caused the top to blow off. So I think that caused a change in how they handled the specimen a little bit. Because where they mixed it and where they tested it were on different floors. And in case you didn't know, there is something called a Bristol stool chart. We actually have a chart that tells us what kind of poop you have. This is an actual thing. I didn't make this up. It's used all over the place. We will actually grade stool samples based on this to determine whether it qualifies for certain kinds of tests. So there's type 1 through type 7. And I've shown that to students and they didn't believe me that it's real, but it is. It's the Bristol stool chart. You can even get t-shirts with it on it. Good times. So in chemistry as well, here just a second, I'm going to share my sure why it wants to do that. Okay, just 1 sec. That was a quick little clip from when our licensing or our certifying body decided to create a Indigo lab coat, and you can see that how tiny that type was, how little that was, in order to demonstrate how many tests we do all the time, every day. And it's really cool, and they've mostly used it as a promotional thing, which is kind of a shame because I want one. Now, chemistry, a lot of chemistry is actually done on a big machine, which I actually have behind me. So this is a chemistry analyzer. It's the Integra 400. Now, I don't have it on, so I can't pull a lot of things out because when it's on, it's very, very loud. But on these little racks here, we'll put specimens. The machine will read what test you want to do on that specimen, and we'll use these other racks over here that have reagents or things that help us test the specimen and do results. It will test it all for you, all inside this machine. So that machine has the ability to do, I don't know, hundreds of different tests, and it can do 400 test samples in 1 hour. And this is a small machine. There are much, much bigger ones. Another quick video for what we do in the lab. This was my certifying body again. A little glimpse of the behind the scenes that we do. And when I worked at in PEI, I actually did the night shift, so I did all the things that that lady was doing by myself. I did urine samples, I did chemistry samples, I did blood banking samples. So that's actually a very accurate depiction of a small hospital and what it's like. So here on this last slide, I have some other places you can go if you want more information. IndigoLabCoat.ca, which will tell you about the Indigo Lab Coat initiative. Our certifying body, CSMLS.org, medical lab professionals, about who we are. And of course, NBCC.ca for anybody that is at that point where they might want to go and look and see about professions. So I think I still have a couple of minutes.
If anyone has any questions, you can either type them in the chat or raise your hand, and then we can give you the chance to ask Rachel a question.
Absolutely. And I have a quick little quiz for you too.
The only thing I see that we couldn't hear the music in the video, but
Oh no, that's a shame.
but we could
Oh, well.
see what was happening, so it was still informative.
Weird. Yeah, the last video did only have music, but. So if you're familiar with Kahoots, there's a quick little. I'm just looking at the chat there a little bit. How long have I been working in my career? I have been in MLT for, oh my goodness, 8 years now. Have I ever spilled a sample? Many times. It's one of the reasons we wear a lab coat. You get used to trying to close things and not knock them over, but sometimes you'll knock a urine on yourself. One time I was putting blood in a test tube and the test tube had broken and the bottom was gone. So I was just dripping blood right into my lab. So that's why we wear lab coats. Another time I was handling a specimen and someone came in and it's really loud in the lab. And I was really surprised and I jumped and splashed blood everywhere. So yeah, that's why we wear lab coats and gloves and these fun geeky things right here.
We have lots of people joining in Kahoot. That's great.
That's lovely. And it's a pretty quick one. There's only like 9 questions, so. Well, thank you so much, Mary Jo. That means a lot. All right, let's get this started. Let me. You are very welcome, Veronica. Thank you. Okay, it keeps resetting itself. All right, so we're going to start. So our first question, which applies to blood transfusions? Which area is blood transfusions? Is it histology, hematology, transfusion science, or microbiology? Transfusion science applies to blood transfusions. Hematology is the study of blood, so they are related. But transfusion science is where we are looking at what units can we transfuse. Epic Urchin, I love the auto-generated names. They're so adorable. They're my favorite. How many decisions made by doctors are based on lab results? 10%, 25%, 70%, or 50%? And the answer is 70%. About 70%, 70 to 75% of all doctors' decisions about your treatment are based on the lab results that we provide. Epic Urchin still at the top, followed by Red Otter, and Clever Cat has risen up a little bit. Which is the study of blood? So if you remember your first question, this might help you. Which one's the study of blood? Hematology, right. Hema means blood. Tology is the study or science of something. And don't feel bad if you're getting questions wrong. This might be the first time you've ever encountered any of this. So the fact that you're even here trying, I'm super pleased. Clever Cat's really climbed up there. Polite Sphinx is in number 2, Lucky Impala. Eager Crab and Golden Squid are on our scoreboard right now. If a doctor ordered an electrolyte test, which department does it go to? This one's a little tricky. Remember the reports that I showed you. That one is chemistry. I didn't say it necessarily specifically, but in one of the reports we talked about there was electrolytes that were one of the tests. And a lot of tests go to chemistry. Clever Cat still at the top. We have some new people on the board. Tropical Seal, Joyful Lion, Inspired Macaw, and Quick Goose. That's wonderful. So which is the study of infectious organisms? Microbiology, right. That's what we study, all of our little bugs that can make us sick. Clever Cat still at the top. We have Noble Gator that's climbed up to 3rd place. How many lab tests are performed every day in Canada? What number of lab tests are performed every day in Canada? $1.2 million tests are performed every day in Canada. Which medical profession is responsible for providing lab test results? Respiratory therapist, medical lab technologist, nuclear medicine technologist, or medical lab assistant? And that's medical lab technologists. Medical lab assistants are fabulous. They do great work for us, but they can't put the results out. And we've run over a little bit, so I'm going to have to skip the last couple just so we're not cutting into anyone else's time or any other things you wanted to do, because this was a little bit slow. Some of you got histotechnology, that's great. So number 3, at spot 3, we have Knowing Badger. At spot 2, we have Quick Goose. And at spot number 1, we have Clever Cat. Great. Thank you so much, everybody, for participating. That was wonderful. It was great to have you, and I loved having the chance to talk about all of this. And I really hope I've sparked an interest in lab science.
So on behalf of the district, I want to say a big thank you to Rachel. That was such a fantastic presentation, and love being
So
able
much.
to have the interactive part with it, with the Kahoot and the poll at the beginning, and seeing the samples makes it really very
Yeah, that's what I thought
interesting.
too. Yeah, it's
So
so much
thank
more
you
real
so
than
much.
just seeing pictures. Yes.
Yeah.
You're very welcome. I was very pleased to do it. Thank you.
Thank you so
And
much.
the session
Rachel.
is recorded, so if anybody wants to watch it again and show it with another class, you can do so. And yes,
Cool.
thank you very much, and have a great afternoon, everyone.
Thank you very much. Have a good afternoon. Bye.
That was fabulous.